All right, well, let's go on. Richard, I'd like to have you discuss a little bit about brain health strategies that could be integrated into a diagnostic and therapeutic approach to Alzheimer's disease.
So before answering this, and just first of all, it's tremendous that we can now start talking about brain health and how to integrate it into an Alzheimer's disease plan. And I think first, though, it's important to understand kind of the spectrum of Alzheimer's disease. So Alzheimer's disease dementia is when a person has developed cognitive impairment, specifically memory as well as other domains, where someone can no longer take care of themselves, and thus they qualify for Alzheimer's disease dementia. Mild cognitive impairment is pre-dementia state, where the mild symptoms are occurring, but they can still take care of themselves. And that would be in a different, rather than treating Alzheimer's disease dementia, it's more preventing or trying to reduce risk of progressing to Alzheimer's disease dementia. So that would be called tertiary prevention. Secondary prevention of Alzheimer's disease is when someone has amyloid in the brain, but no symptoms. So that would be a construct called preclinical Alzheimer's disease or secondary prevention. And then primary prevention is a little more murky, but maybe where we need to go at some point, and that's primary prevention of Alzheimer's disease as a pathophysiologic feature. So the terminology here is confusing, but brain health strategies may be preferentially effective or less effective depending on where a person is on the spectrum. So when it comes to lifestyle changes, Mediterranean-style diet, exercise on a regular basis, cognitive engagement, and cognitive training, some of these interventions may work preferentially much earlier in the spectrum. But when someone has Alzheimer's disease dementia, for example, moderate to severe, even mild to moderate, there's even studies that show maybe rigorous exercise on a regular basis leads to poorer outcomes. So I think sometimes this stuff is a little bit unclear, but integrating aspects of physical activity, cognitive training, Mediterranean-style diet, music therapy and music activities, the list goes on and on. I think every person with Alzheimer's disease needs to think about non-pharmacological approaches as much as pharmacological approaches, and I think the evidence for these approaches are evolving rapidly.
Very good. Anybody else have a strategy for brain health in their practice?
I've heard some statistic recently that up to a third of cognitive impairment or dementia could be delayed, postponed, prevented with lifestyle interventions. So this is an area of tremendously rapidly growing interest. We'll prove it over time, but it is an area of great interest.
And actually, I believe the data, again, the level of evidence needs to be supported more, but it does make sense. Some of it may be directly involving the disease mechanism, but the other ones are just improving your brain reserve, I think. And so the Lancet Commission paper from 2017, I encourage people to read the evidence for themselves. I talk a lot about lifestyle changes as a part of what individuals can do who are symptomatic, who have, let's say, mild Alzheimer's disease. The benefits, I think, again, it's the sweet spot, how much. If you say over-rigorous, if they're overdoing it and they're dehydrated all the time or they're getting rhabdo or something like that, that's a different story. But tremendous benefits for sleep and mood. And I don't know what it is, but I think we'll know eventually how probably this combination of the medicines we have and lifestyle changes are going to be beneficial and be kind of synergistic to individuals.